You are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello, listeners. I'm Urvashi. Today, we will discuss cataract causes, its diagnosis, and treatment with our expert Dr. Virendra Sangwan, who is an ophthalmologist and he is a director innovation at Dr. Shroff's Charity Eye Hospital, New Delhi. He worked at LV Prasad, Hyderabad over 20 years. He's known for his research on limbal stem cells. Dr. Sangwan is the founder, secretary, and an advisor of the Uveitis Society of India. He has been awarded the Shanti Swarup Bhatnagar Prize for Science and Technology by the Council of Scientific and Industrial Research, the apex agency of the Government of India for Scientific Research, one of the highest Indian science awards for his contributions to medical sciences in 2006. Hello, Dr. Virendra. Welcome to a podcast for patients, caregivers, and healthcare professionals at Medica Talks.
Good morning. I'm
Uh,
very happy to be here with Medica Bazaar, and I'll be very happy to discuss cataract and its various causes and how we treat.
sure, doctor. So, can you tell us about cataract?
Yes, let us understand first how the eye works. Eye works like a camera in a simplified way. The camera, you have a lens and you have a shutter, and then the light focuses on an object and you click. So the shutter is like the eyelids, and the lens, what is there in the camera, is inside our eye, which is called the human lens. And this lens is normally transparent when we are young. As we get older, it becomes slowly degenerated and it loses its transparency and it starts becoming opaque. And that is called cataract. When it becomes opaque, then light cannot pass through, or it will be very blurred vision, or it will start affecting the quality of the vision. So that is all in its forms called cataract. And it generally happens in the older age, as we get older.
So, what causes cataract basically?
As I said, there are a variety of causes for the cataract, but the most common, I would say, in 70 to 80% of the patients, it is called age-related cataract, or what we call senile cataract. Simply because you are getting old, that is why there is a cataract. Other causes include traumatic. If you get hit on the eye, or if you met with an accident, then also the lens can become cataractous. Sometimes it can be a side effect of medications, like people who take medications such as steroids, which are used for treatment of eczema, allergies, and variety of other conditions that can cause cataract. So some diseases can cause cataract, like uveitis or intraocular inflammation. Patients, young patients, newborns can have cataract. That's called developmental. Patients with blood sugar or diabetes can get cataract due to raised blood sugar in the body. It's called diabetic cataract. So there are very large number of causes, but majority is due to age-related factors.
Okay. So, what are the symptoms of cataract? Like, how do I come to know whether I have cataract or anybody for that matter?
The simplest thing that one would notice is that there is a gradual, painless loss or decrease in vision over a period of time. It rarely, very, very rarely causes sudden loss, but it is a gradual over the years. It doesn't happen overnight, and the you don't lose vision completely. It becomes blurred. It may alter the intensity of the light. It may alter the color visual perception, and also it depends on the location of the cataract, meaning if it is in the center of the eye or in the visual part, then you may have symptoms only when there is a bright light. So it depends on many factors that what kind of symptoms, but generally it is painless. Other than that, you don't have any symptoms. Painless, gradual loss of vision. You don't generally get watering or redness, except there are very few exceptions.
Okay. So, are there any different types of cataracts that are, types of
Yes,
cataracts?
based on the etiology what we were talking about, there is a something called pediatric cataract, and in that pediatric cataract, you can have developmental, you can have congenital, meaning you are born with cataract. Developmental cataract is something that you develop because of errors in your metabolism or lens or any
Right.
other signaling process when the child is growing in the young age.
Hmm.
Then there can be due to what a variety of other causes that we have talked about, nutritional. It can be due to, meaning if your diet is not good, you may get cataract. It may be due to injury, medications, maybe inflammation, and sometimes it may be due to some sort of high fever, which happens in certain type of infections.
Okay.
And age is
So,
the most common factor. Age is the most common factor that would be responsible.
okay, so as you said, it develops maybe in the later stages. I mean, in the later
Part of
years,
the life, later part
part
of
of
the
the
life.
life, right?
Yeah.
So, how is cataract diagnosed?
Basically, what would happen is that you normally go for an eye checkup, and if you say I have my vision is not good, though, so the eye doctor or the optometrist will check, and he or she will try to rectify with the glasses, and then the optometrist or doctor says, oh, if the vision is not improving with the glasses, so then they will do something called dilated examination, or where we put the dilating drops and look at the inside of the eye. And with the bimicroscope called slit lamp bimicroscope, we look into the eye and we will be able to see it directly. Now there are some other imaging devices, but mostly it is a clinical diagnosis with a slit lamp, which we can directly see and say, yes, you have cataract.
Yeah.
And this decrease in vision or blurred vision is attributable to this factor.
Okay. So, what is the basic treatment of cataract? How is the process done?
The treatment for the cataract is primarily surgical. There is no medical treatment of cataract. There is hardly any prevention that you can do. So for senile cataract or other kind of cataract, the only option we have surgical. And there are variety of techniques of surgery we do. We do with surgery with laser, ultrasound, and then the different type of intraocular lenses that we replace. So
Okay.
primary treatment is surgical.
Surgical. So, are there any preventive measures to avoid cataract? Like, is it avoidable?
It is avoidable only in certain situations, like if you have a drug induced, like if you're senile cataract, which is almost 80 to 90% of the situations, there's no way to prevent. Number two, in drug induced cataracts, yes, you can, meaning that you know that this drug can cause over a period of time, so you have to find a way of using alternative medications or alternative methods to prevent the cataract.
So, you mean to say there are certain drugs that we take, like certain medications that lead to cataract?
Yes, that's true.
Okay. This is something.
Yeah, notorious among them is the corticosteroids, which are very often used as eye drops, which are used for the treatment of asthma, all rheumatoid
Mhm.
arthritis, eczema, and variety of other conditions. And so
Okay.
that can cause cataract over a period of time.
Okay. So, sir, any message that you would like to give to our listeners right now?
The only message that I like to give to your listener is that cataract is not something very serious condition. It is more of a age-related lifestyle disease. And if you are diagnosed with it, you should go to a good doctor, a good surgeon, essentially, because the surgery is a very delicate part and it is very sophisticated. There are variety of techniques, variety of intraocular lenses available. So you should go to someone who can safely do good quality surgery for you.
Okay. Thank you, doctor, for being a part of Medica Talks and sharing your insights. We are glad that you were a part and you gave your valuable time to us. And I'm sure that the insights that you've shared will be of great value to us, and people will actually try and solve their issues
Yes, thank you
at the
very
right
much.
time. Thank you,
Yes,
sir.
thank you very much. Thank you. Bye.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.